Secretary, thank you for joining us, for having this conversation as we mark kind of 1 year in this new role for you. What's your first year been like on the job?
Well, it's been a whirlwind. It's been exciting. It's been transformative, but there's still so much more to do. I'm excited about what we've been able to do, but the opportunities moving forward.
Cool. And, this is shortly after you were sworn in. You said that one of your goals was to rebuild trust in the veterans community. You talked about it being kind of both a startup and a turnaround. Where are things now in that turnaround? What's the, trust meter that you've seen?
Well, without question, the Executive Office of Veteran Services really came out of a piece of legislation that really elevated this position to a cabinet level. Partly because the veteran community had been asking this for a long time, but also because of what had happened during COVID. As you know very well, over 100 veterans died tragically at Holyoke and at Chelsea. And so this was a response to that, and a big part of what had happened there was just a loss of trust in the veteran community, particularly at Holyoke and in Chelsea. And so we sought to address that head on. As a physician who worked during COVID throughout its entirety, I had a first-hand glimpse into it. I met with the staff, the veterans, the families, to talk to them about their experiences and their trauma. And so the first year was really about creating a culture of accountability, of streamlining efforts, of making them more efficient, of making sure that the veterans and the staff know that we in state government have their back.
And there was that, kind of really blistering series of reports faulting the series of decisions made in the Holyoke Soldiers' Home that contributed to the deadly outbreak there. What's changed since then regarding the standards of care, the protocols around things like infection control?
Well, let me just say that we've sought to standardize and professionalize the entire system, working closely with DPH and a variety of other stakeholders. We have leadership in place with Superintendent Mike Lazo at Holyoke. We just hired Christine Baldini a couple of months ago, 25 years of nursing home experience, really a leader across the state. We've put these two institutions in a better place, and although we can't forget the past, we can shape the future. So really closely working with them to align our efforts to make sure that we are following evidence-based practices and committed to making sure the experience from the staff and from the veteran is exemplary.
And so maybe if you're a veteran living in one of those homes, what's different now versus 4 years ago or before?
Well, there are a variety of regulatory things that are different. As a part of the legislation, these homes had to be licensed, had to go through DPH, CMS licensing. We've done that at Chelsea. We're working on that at Holyoke. But I can tell you that in the homes, but also outside the homes and the programs we offer, it's really been about engagement, really. And that starts with listening. Because to me, whatever career I've had before, if we've tried to be a leader, that's always started with listening. So going to the homes, first weeks into this office, spending time there at Chelsea and Holyoke, listening to the veterans, listening to the staff there, to the superintendents, really putting in a leadership structure that is going to hold themselves accountable, hold me accountable. That's what this is about.
And as we're talking about the leadership at these homes, we did see just this week two of the former officials at Holyoke settled their neglect case in a way that's going to allow them to not face any jail time. Do you think that was the right outcome there?
Well, I'm not a judge. I don't practice in the legal profession. All I know is that as a physician, as a secretary there who's committed to supporting our veterans, we're glad that this chapter is closed and that we plan to move forward with this. We're excited that both homes, one of which has been rebuilt and occupied right now in Chelsea, and that we were able to secure funding to build a brand new home at Holyoke. And I think one of the things that we did when we had that groundbreaking in August in Holyoke was to meet with families of those who had lost loved ones. The governor was there, the lieutenant governor was there, Congressman Neal was there to say, listen, we're doing this for you. We're investing this money, improving services, increasing services to honor the families that lost a loved one, but also those that are currently there.
And as you think about those families, are you concerned that as they watch this outcome in the court system, that it's going to contribute to that lack of trust that you've been working to rebuild?
Well, I'm sure that a piece of their heart was lost when their loved one went, and we can never take that away from them and bring them back. But we can shape the future and making sure that they're engaged and that the veterans that are still there and the families that are still involved with Holyoke or still living there, that they are getting the care that they deserve, and that's what we're committed to doing. And I'm excited that with Superintendent Lazo's leadership, with the folks there, that we're doing that right now. And let me just say, COVID will always be with us, right? We have tools, antivirals, personal protective equipment. We have an understanding of it that we are so far away from where we were in 2020. I can remember being in the emergency department as a physician. The first couple of days, folks are scared, concerned, worried, rightly so. I was one of those folks. But we've changed so much in terms of how we practice, how we educate each other, how we prevent this, and we've instituted those things at both homes to make it a safer place. And I'm confident about the work that we're doing there day in, day out to make it a better place, make it a safer place, and to support our veteran community.
I'm curious, too, if you can tell me a little bit about how your background, both as an emergency room doctor and your own military experience, shapes the way that you approach this job.
Well, both of those experiences, being in the military and the emergency department, it's really about leadership. It's like, how do you create a vision? How do you bring resources into that vision? How do you bring folks together to accomplish an important task here? Oftentimes with many stakes, high stakes situation in the emergency department in particular. And to me, that's always beginning with listening, right? That's why when we started this office, one of the very first things we did was to commit ourselves to visit every county in the Commonwealth, to sit down with veteran communities who have felt like they have not been listened to, felt like they have not been engaged with, to hear about their concerns, and to frankly say to them, we hear you, we want to work with you. We might not always have the solution that you want. Just like I tell my patients, I might not always have the cure that you need right now, but I can tell you I'm going to work with you, I'm going to advocate for you, and I'm going to be your champion. And thus far, over the past year or so, I think that's resulted in a variety of things that we're seeing that are transforming veteran services across the Commonwealth of Massachusetts.
You know, and another former role that you've played is as a state lawmaker, and you've had the chance over the past year to testify in support of and speak out in favor of some legislation that Governor Healy has filed, dubbed the HERO Act, a bill that aims to, I believe, kind of modernize and expand veterans' benefits and services. What do you see as the need for a bill like this?
Well, what we did is that we looked at 50 states, 49 other states rather. Where are the gaps in services here in the Commonwealth? What are other states doing? How can we bring those practices here in the Commonwealth? How do we make sure Massachusetts is the leader across the entire country when it comes to veteran services? What I've come to learn over my time here is that foundationally there was some strong programming there, right? But what COVID and the experience at Holyoke and Chelsea taught me was that when the situation at Chelsea and Holyoke resulted in the tragic deaths of 100 plus veterans, that those issues, that lack of accountability, didn't just exist at the homes, that they infiltrated other parts of government as well. So we really had to reinvent how we go about our services and our programs at the Executive Office of Veteran Services. We had to pay just as much attention, be just as diligent when it comes to building program, fostering growth, making sure that folks are engaged. And so that's what the HERO Act is a part of. We saw a variety of gaps that needed to be addressed. We sought to modernize a number of things. We sought to increase benefits, and particularly when it comes to inclusivity, which I care passionately about, and the governor and lieutenant governor are big leaders when it comes to this, making sure that people feel engaged, invited to this. As you know, there are a variety of, women are the fastest growing group in terms of veterans. You have veterans of color who are out there. You have veterans who have been discriminated in the past for gender or sexual orientation. And so we wanted to make sure that folks are involved and engaged. And we put forth the HERO Act, 17 proposals, and we're excited to see it go through the legislative process. We have full faith in that process with the Senate and the House, Chair Cassidy and Chair Velas, big champions of the veteran community, to support a bill hopefully to come out before the end of the session.
Yeah, I know the committee that is reviewing that bill has about another month to do so. Have you talked to any of your former colleagues in the House or the Senate about when we may see something? I know there's often interest in doing a veterans-related or military-related package around Memorial Day or Veterans Day.
Well, we're in communication. I mean, we speak about a variety of issues with respect to the HERO Act, legislative and otherwise. And I trust that they're doing their work here. Obviously, it's going through the legislative process, and when that's done, hopefully it'll end up on the governor's desk, and she'll have a great bill to sign.
And I know another thing that has taken a lot of the legislature's attention lately is the situation around shelter capacity amid the influx of new immigrants to the state and other homeless families. It was announced this week that the former, do I have this right, the former Chelsea Soldiers Home building will be used as an overflow shelter site for people who are waiting for shelter. Is that going to affect care or operations in Chelsea at all?
The short answer is no, not at all. Operations, the veterans at the home and the veterans at the domiciliary as well. I mean, this situation is a very challenging one, the emergency assistance program that you're referring to. This is one that we've had in Massachusetts for decades, right? We're at capacity here. I think the governor has been very sensible in terms of crafting a policy that is both pragmatic but also empathetic to the families that are coming across the country here and from other parts of the world here. And there is a building that is currently vacant, that is scheduled to be demolished over the course of the next year or so, and it is now going to be used to house emergency assistance families, pregnant women, and folks that are overflow sites that are typically that you've seen in Roxbury and Cambridge.
So, and as we see this situation continue to unfold in the family shelter system, the Healy administration is also recently launched an initiative aiming at ending veterans homelessness in Massachusetts.
That's right.
What kind of effort is that going to take? That sounds like a pretty big goal.
It is a pretty goal, but Governor Healy and Lieutenant Governor Driscoll think big, and they're visionaries. And from the very beginning of their administration, they've tasked all of us, how can we address housing, the number one crisis we're having in the Commonwealth? Irrespective of where you may live in state government, we operate a Veterans Secretariat. Some may ask, what does the Veterans Secretariat have to do with housing? A whole lot. There are homeless veterans across the Commonwealth. And over the course of the past 10 years or so, that number has dwindled down, but they still exist. If you look at the data from the annual once-a-year count that we do, there's still about 500 to 600 veterans who are homeless. The majority of them living in transitional housing, so have a roof over their head today, but looking for permanent housing. Now, there are supply issues, as we know, and so Governor Healy tasked all of us, all the secretaries, to really think thoughtfully about this, to work together. So early on in my tenure as secretary, we began to put ideas together alongside Secretary Augustus to come up with a plan to address veterans homelessness. And it's a 5-pillar plan, really focused on direct outreach to veterans, coordinating efforts across state, federal, and local municipalities, really, investing in some shorter capital needs that are required, but really making sure that folks feel coordinated and engaged, because there are a variety of services, resources that are available right now. But if we better allocate them, better coordinate them across the system, we will get to what's called functional zero. And what that means is that homelessness in the veteran community is short, brief, and not reoccurring. So that's our goal over the next couple of years.
There's a few cities across the state that are already at that functional zero level,
correct.
Right?
There's a few cities, there's a few states, but so we're almost there. Again, if you look at the annual count, 545, I believe what the number is, and most of those folks live in transitional housing, looking for permanent housing. If you look at the numbers of unsheltered veterans, it's closer to the 30s and 40s. Now, it is very challenging, obviously. As someone who works in a safety net hospital, you're dealing with folks who are challenged with the housing situation, but also mental health and substance use. The same thing could be said for the veteran community as well. And so these are communities that you have to purposely engage with. You have to really validate their concerns, work with them, provide strong case management and wraparound services, and really coordinate services across the state. And we're looking forward to launching that. We launched the campaign a couple weeks ago, but seeing that through over the next couple months, couple years.
You mentioned mental health as well. I know a couple years ago there was a new mental health law passed in Massachusetts that created a panel to really look at mental health among veterans and service members and ways to guard against suicide in that population. I think there was recently a report filed, or a few months ago, What more does the state need to be doing in this area?
Well, this is something I feel passionate about as a physician, as someone who cares for many patients with mental health and behavioral health concerns. Now, when veterans come back, or soldiers come back from abroad, as a veteran myself, that experience may be shocking. It's transition. You might be entering a new state. You might be dealing with some issues that you've experienced abroad. You're looking for a job, looking for educational opportunities, at the same time trying to understand what it feels like to be outside of the military. And veterans need the support. First of all, they sign their name to a contract to defend their country, right? So the least we can do as a Commonwealth and as a country is support them, right? And so we are looking forward to the next year or so to put forth a plan to better address veteran suicide. Now, those numbers have been slowly creeping up, which is of concern. One of the things that really shocked me and saddened me over the course of this past year were the number of calls that I've received from families, from the DOD, about military-affiliated folks who have passed away, some of which by suicide. That's something that I wasn't expecting to receive at the rate that I'm receiving now. And so it's really hit me at a personal and a professional level. And so we want to get active on that. So we've activated a team across state government, because there are a variety of different folks in state government operating in this space of suicide and mental health, behavioral health, substance use, focused on veterans. So we've put them together, created a working group, and over the course of the next couple of months, we plan to put forward a plan in conjunction with other stakeholders to really address this, take this head on. The first step was the report that you referred to. That was a report that our team worked alongside a variety of stakeholders to put together early on in the administration. We have the recommendations, a lot of it focused on how do we support peer support services, informal across the state. What do we do about lethal means? I mean, if you look at the characteristics associated with veteran suicide, it's often done via lethal means. It's often associated with substance use and mental health issues. So we have a lot to work to do on that, but every veteran is a life worth saving, and we're looking forward to getting folks in a room over the next couple of months and coming out with a plan.
Yeah, I'm looking forward to seeing that plan. As you've got kind of so much on your plate and so much work ahead of you in these hefty areas, are you concerned at all about, I know the state has been facing a revenue squeeze with some projection or revenue collections trailing projections over the past several months, slow growth projected next year. Are you concerned at all about being able to afford to do the work you want to do?
Well, I think looking at the HERO Act and taking my experience as a former legislator, really looking at ways that we can make things more efficient, more streamlined, without costing a significant amount of money. I think that's what we sought to do throughout the entirety of my one-year tenure here, and we're doing a pretty good job. I think when you put people in a room, when you have resources, when you put forth a vision, and when you have the leadership to see that vision through, you can have some good results without spending a lot of money. And that's what we've been able to do thus far. I think about this past year, I think the fact that we've been able to open up a brand new home at Chelsea, one that was slated to be open 2024, at the end of 24, we expedited that, got that built, got the licenses, moved the veterans in. I think about the fact that we've been able to secure hundreds of millions of dollars from the federal government to build a brand new home at Holyoke, and that we're meeting all the milestones with respect to that we've built a brand new cabinet, and that we're turning it around and really instilling trust in the veteran community. There's a lot more work to do, but we're off to a great start. And right now, really the focus is making sure that we build that culture of accountability and teamwork throughout the entire Secretariat, including the homes.
All right. Well, Secretary, thank you so much for walking through it with me, and we'll be watching to see what happens in year 2 of the Secretariat.
Well, thanks for having me.
Thank you.
Yeah.